is a very important component for child's mental and physical development. But many children face sleep issues and which may affect their health, behavior and daily functioning. Some of the common sleep issues are due to the developmental factors because the immature brain of the child may have many sleep issues. Environmental factor, if there is too much light or noise in the room, will affect the child's sleep. Psychological factors, if the child is having any anxiety or any stress, which will affect the sleep of the child. Medical conditions, certain allergies, asthma, or developmental issues like ADHD, autism, or even genetic condition like Down syndrome, affect their sleep is greatly affected. Poor sleep hygiene, because the hygiene is very important. There should be a proper routine for the sleep and should wake and sleep and wake at a similar time every day. And effects of sleep deprivation, it can lead to behavior issues. The child may be having hyperactivity, irritability issues in the child, and it may affect his academic performance because there can be a effect on the cognitive development of the child. Memory can get affected and which will affect the academics. Emotional impact. Some children will have behavior issues, will have mood swings due to the sleep deprivation. An effect on physical health because chronic deprivation of sleep can cause the weakened immune system of the child and also exacerbate certain health conditions. So what should we do to improve the sleep of the child? First is a very nice routine should be established, and it is very important to have the routine all on the week and weekends. Have a good environment for the sleep of the child. There should not be any noise or any light in the room. Then you should have good healthy practices before the sleep, like listening to music or reading a book, and a regular routine before the sleep. And limit the use of screen time. There should not be any TV or mobile use before the sleep. Addressing the underlying conditions. If the child is having any illness, it should be taken a physician's consultations and the sleep issues can be sorted out. There should not be any stimulants before the sleep of the child, especially sugary foods, chocolates, caffeine products, which will affect the sleep of the child. Behavior interventions. Some children shows a lot of behavior issues and they have to be dealt with positive reinforcement for good behavior of the child. So in the short, I can say sleep is very, very important for the child's growth and development because it's during the sleep time. There are many hormones released in the child's body and they help in the proper growth and development of the child. Sleep issues should not be ignored by the parents and they should take timely help if there is a chronic deprivation of the child. In such circumstances, immediate doctor's help should be taken and these sleep issues should be addressed for the better health of the child. So, please help your child to rest better for his healthier tomorrow.